afternoon, and I think it's quite timely that as we eat our dessert, we should ponder upon exercise. Yeah. So we know exercise has many benefits, especially what we know is mostly of non-communicable diseases now. So regular physical activity in the correct intensity can reduce the risk of heart disease, stroke, diabetes, hypertension, even breast cancer, colon cancer, Alzheimer's disease, and it has even been shown to decrease the risk of depression as effectively as medication or behavioral therapy. In fact, it's interesting. Oh, yeah. So it's interesting that tremendous exercise benefits actually can be seen with even low levels of exercise. This is what the American College tells us. And the amount of exercise that we need to benefit health is actually much lower than the amount that we need for fitness. So even a little bit is better than nothing. So we say we are in the middle of a pandemic, but yes, do not forget that actually much earlier pandemics did exist. And we are talking about the pandemic of physical inactivity and the global obesity pandemic that has been with us for the past few decades. And we can see here on this graph, at least in the past 3 decades, we see a marked increase in obesity among children, and this is in various countries in the US, Europe, and Asia. So WHO has classified physical inactivity as the 4th leading cause of death worldwide after hypertension, smoking, and diabetes. And there has been evidence actually of health benefit of physical exercise ever since as early even the 1950s. But this is something that is really very difficult to get people to do. And I think a lot of efforts actually to promote that has been lagging behind. And we would just like to emphasize that the benefits of exercise holds true even during this current COVID pandemic. So we shouldn't be afraid to exercise because we are afraid of catching something. In fact, individuals, especially those at higher risk of COVID complication, and we are talking about this group here, older adults above 65 years old, people with chronic diseases, as well as people with compromised immune systems, actually stand to gain more with regular exercise in terms of protecting them and making them more fare better if they should catch infection. But of course, they have to do this inside, with safety precautions, perhaps in a fitness facility or at home with appropriate precautions. And moderate intensity physical exercise actually has been advocated by international bodies as to be associated with better immune outcome. And the key word here really is moderate intensity. And many papers about COVID infection has sprung up, I would say, over the past 2 years or so. So just between 2 short months, April and June of 2020, 51 articles were written, and reviewed in this literature review from PubMed on physical exercise and COVID-19. And then I think the message is very clear. So they look at the adverse prognostic factors for COVID-19 patients, and they find that, of course, the usual ones, bad prognostic factors, overweight, diabetes, hypertension, coronary heart disease, cerebral vascular disease. These are all people who do badly. But it is interesting to note that sedentary behavior, as well as physical inactivity, these are also among those bad prognostic factors that came up, and these have been found to be associated with chronic, what Dr. Chow mentioned earlier, the hyperinflammation state, and these can lead to more serious forms of COVID. And in addition, exercise has benefits in improving immune function. And when I was preparing for this talk, I actually came across this interesting thing that there is now a specialty called exercise immunology. So they found that they study exercise and its effect on immunity or immune reaction. And they find that, again, moderate level of physical exercise has positive effects on many immune markers, and they can provide an immune protective effect. And in addition, exercise also is able to attenuate the pro-inflammatory state that is induced by COVID-19. And when the experts look at all the 5 mechanisms that are going on, most of them are mediated by the cytokines, and they find that fitness or physical activity actually increases anti-inflammatory cytokines, and that's how it has its benefit in moderating overreaction of the immune system in the COVID infection. And they very often will mention things like the interleukins, 10, 1, 6, etc., and many other big words that we seldom use. And at the same time, exercise is able to downregulate those modulators of a hyperinflammation state, and very often they will mention things like toll-like receptors on the cells, and these are the ones that, if they are excited, it can actually induce a strong immune response. So because of this, there's a postulation that the benefit of exercise in COVID patients really is one of the big thing is actually reduce severity of the cytokine storm. And in fact, they have done also animal studies and showed that those spike proteins that you saw in the diagram earlier that attached to the ACE2 inhibitors, these are also, the effect of this kind of binding is also very much reduced by exercise, but this is in animal studies using mice. Yeah, so in the clinical setting, there is a report, this is coming out from the USA, where 48,000 over patients who are diagnosed to have COVID in 2020, they were classified according to the level of how much they met certain physical activity guidelines versus inactivity. And they found that the inactive group have a higher risk of hospitalization, of admission to the ICU, as well as mortality due to COVID-19. And this is how they categorize the patients, 3 categories based on the physical exercise guideline for Americans, which sounds like a big word, but in reality it is the how many days a week you exercise and how many minutes a day, and then you multiply that and you get your total number of minutes exercise in a week. And they call this parameter the exercise vital sign. So if exercise vital sign greater than 150 minutes per week, which actually, if you think about it, is the normal recommendation of 30 minutes a day for 5 days. Yeah. So if they consistently meet this guideline, versus those people who do not, hardly, like less than 10 minutes a week of, it's difficult to imagine, but less than 10 minutes a week of a moderate to vigorous exercise versus those people in between, they found that the most inactive group have the highest risk of hospitalization, ICU admission, and that's how they got the data earlier on. Yeah. So the paper concluded that people who meet these physical exercise guidelines, they are strong. The outcome is strongly associated in terms of the severity of the COVID infection, and therefore they actually recommend that in addition to the various preventive measures and vaccination and safe distancing and so on, that people should pay more attention to physical activity as part of their preventive measure from the public health point of view. Yeah, but then there is also will be other school of thought. I think even this is even before all the COVID, before COVID time, so-called, yeah, where data has come out that, if people train at very high levels, especially competitive athletes, marathon runners, and so on, they have a lot of physiological, metabolic, and psychological stress, and these are thought to be no good, and that this kind of exercise is in fact associated with high inflammatory markers, and definitely there have been reports of more upper respiratory infections, for example, of athletes entering competitions and so on. So they suggest that this kind of immune dysfunction can occur from a very high level of training by suppression of the metabolic function of immune cells. But then these are, when we look at the data, really they are talking about people who are exercising a lot more than you and I in everyday setting. So the usual recommendation of moderate or even up to vigorous exercise in bouts of less than 60 in total, of less than 60 minutes per session actually has not been shown to have a negative impact on the immune system. But just to look at the other end of the spectrum, what the vigorous exercise can do. So this is what they are trying to say. In the dark blue, this is a marathon race, 42.2 kilometers. And the light blue bars are 30 to 45-minute brisk walking, like what you and I do. So, and on the y-axis here are all the various markers of immune response. So if you are on the positive side of the scale here, means there is a good effect on these immune markers. And if you're on the negative side here, it means you have a bad effect on these immune markers. So you can see at a glance that the dark blue, the marathon race, cause quite a lot of bad things to happen to the immune system. There may be some good things, but it's more bad than good. Whereas regular, more moderated kind of exercise is almost always associated with some good effect on the immune system. And then also we were talking about the upper respiratory tract infection data. There was a review article, and then they showed a J-curve relationship between exercise and URTI. So we are right to tell the patients that you have to do regular moderate intensity exercise, because when you look at this part of the curve, this is the beginning, from the sedentary to moderate exercise, you find that people do get fitter, less prone to infection, their upper respiratory tract infection index drop. But then this part of the J is not good when you go into the heavy, excessive exertion, where regularly doing so actually result in a higher upper respiratory tract infection index. So it all boils down to how much to exercise, and the regular recommendation that we have known for a long time actually still holds true, even in the pandemic. So what we recommend is 150 to 300 minutes per week. So 150 is the minimum of 5 times a week, 30 minutes. Yeah? And the type of exercise predominantly should be cardio or aerobic physical activity, moderate intensity, 5 times a week. But if you do higher intensity exercise, then it can be 3 times a week. And there should always be about 2 sessions per week of muscle strengthening training, up to about 20 minutes per session, when distributed among the upper body, the lower body, and the core. Yeah. So just some qualitatively, the type of moderate intensity exercise that we may want to try. So indoor activities, like putting on music, brisk walking around the house or up and down the stairs for 10 to 15 minutes, 2 to 3 times per day. That is something a lot of patients can do. Dancing to favorite music, jump rope, follow an exercise video, or use a home cardio machine. And outdoor activities, walking or jogging with safe distancing in the current day setting, nature hiking, bicycle ride, doing some gardening work, and also sports like racket games and golf. But if you want to go a little bit more into the mathematics, because patients, one of the very common questions that they always ask me, what should my heart rate be? You know, it's just one of those things that sometimes people get very worried about when they exercise. So when we talk about moderate intensity exercise, very often we will refer to this entity that is called the heart rate reserve. Yeah, so I think we are more familiar probably with calculating our peak heart rate, which is 220 minus age. So for example, for a 50-year-old person, 220 minus age will be 170. And then we will also look at the resting heart rate, which for example is like we take it as 60 to be easy. So the heart rate reserve is simply this peak heart rate minus your resting heart rate, and which in this example will be like 110. And when we want to, from here, derive the target heart rate that you may want to tell your patient about, then we will take this heart rate reserve and we take a percentage of that to indicate a certain intensity of exercise. So for moderate intensity exercise, that will be 50 to 70% of this heart rate reserve that you have calculated. So this 110 multiplied by 0.6 will be 66, and you add it back to the resting heart rate, which is 126. This is using 60%. And for moderate intensity exercise, the percentage is usually quoted as 50 to 70%. Vigorous exercise is above 70%. So if the person just wants to exercise to keep fit, then 50 to 70 is a good range for moderate intensity exercise. However, if their aim is really to lose weight, then they probably have to do it at a little bit higher intensity, like 75% or something like that. Yeah. Okay. So, although we know intuitively that exercise is good for us, even during the COVID time, but COVID itself actually acts as a big hurdle to exercise. So invariably, you know, with all the emergency measures to control infection and all that, sports events have been cancelled or postponed. People generally found themselves grounded because they can't go to the gym or they are afraid to go out. In fact, in the early part of the pandemic, there is this poster that came out from Germany where the government actually calls the young people who stay at home and watch TV all the time, couch potatoes, actually hail them as heroes and ask people to follow their example and stay at home and don't get out and things like that. So, but this reduced level of physical activity really is something that is bad for people. This paper showed that reduced level of physical activity during the COVID-19 pandemic is actually associated with depression and anxiety. And this is a study done in Brazil of 2,000 over people between the period of March to June last year, when the government imposed measures, closed schools, universities, gyms and parks and so forth. And they found that during this period, definitely there was a reduction in physical activity level, but in addition, even the mental health of the people also suffered. About 30% of people who were surveyed, they actually showed moderate to severe symptoms of depression. And about 23% had moderate to severe anxiety. And this is compared to a pre-pandemic prevalence of 5 to 10%. And they also found that these symptoms of depression and anxiety is related to their reduction in physical activity of these people. In fact, those who adhere more to social distancing measures, they suffer more in terms of the anxiety and depression indices. And what they found a little bit more worrying also is that these so-called mental symptoms are actually more common in the younger patients. So in general, during the pandemic, there is decrease in physical activity because work from home, gym closure, safe distancing, people wear masks, so they don't like to exercise. We expect more physically and mentally vulnerable people, and this in turn actually can have a negative impact on fighting infection. So it is really a vicious cycle. Then there's also this interesting paper that came out, written by a group of psychologists in India, and they talk about perception and behavior of what they call fitness freaks. But actually, these are just regular gym goers who are like in their late 20s. But in this paper, strangely enough, they refer to them as like people who like to exercise a lot. So during the lockdown in COVID-19 pandemic, and they find that these subjects, initially they became very negative because they cannot go back to the gym, and so forth, and they become over-dependent on social media, very sedentary and all that. However, as time goes on, they find that they became more positive over time in terms of self-perception, motivation. They are actually able to overcome their dependence on the gym, and they continue fitness exercise at home. So they actually attributed this to the fact that these people have been regularly exercising. They are actually mentally stronger, and they are much more adaptable when it comes to adverse conditions. So this group of people were subsequently able to exercise well at home with common activities like yoga and meditation, just simply weightlifting, certain high intensity workouts, rope skipping and all that. And they recommend also listening to music as well as social media. I presume is like following certain exercises and so on for people to adhere to home workout. And definitely in this group of people who were initially very negative because they could not go back to the gym, they were able to overcome the psychological issues and fitness concerns thereafter. Then I would also like to point out that very often we talk about lack of exercise or not exercising enough, but actually the other thing that is an independent risk factor also is what we call sedentary behavior. So sedentary behavior is any waking behavior that is characterized by an energy expenditure of less than 1.5 metabolic equivalents, that is very low physical activity, while in a sitting, reclining, or lying posture. Or it can be screen time that is spent, viewing TV, games, and so on. Even driving long distances and reading is also actually considered sedentary behavior. So there's one study where they found that adults who spend less than 2 hours a day sitting of this sedentary behavior versus those who spend more than 4 hours a day. Those who spend more than 4 hours a day have a 50% increased risk of death from any cause and 125% increased cardiac events and so forth. So we don't just think of less exercise, but we also have to avoid sedentary behavior. And this is even way before the COVID, before 2016, meta-analysis of 34 studies, more than 1 million city dwellers. And they find that a total sitting time of more than 6 to 8 hours a day, or TV viewing more than 3 to 4 hours a day, is associated with increased all-cause mortality and cardiovascular death. And this is actually adjusted for level of physical activity. So it's an additional risk factor to just exercise less, not just less exercise, but actually totally sedentary. So therefore, if you are in some of these, come under some of these alphabets like QO, quarantine order, or work from home, where you have to sit for long periods, then not only do we need to increase the physical activity, but also to decrease sedentary behavior. So most of the time we ask them to get up and walk around the house, do some active chore for 5 minutes after every hour of sitting. or during commercial break, although I think that is hardly applicable now with the Netflix, so you probably have to really actively, time yourself about an hour, do something, every hour do something. And it is also recommended to build a home-based physical activity routine. So how to build a home-based routine? Actually, if you do not wish to buy expensive machines, you can use very simple stuff. So home-based routine has 4 components. Firstly, strengthening activity. So this can be done, the squats, push-ups, sit-ups, side planks. It can be done using a person's own body weight or something very simple like this kind of exercise, elastic bands. Second is conditioning activity. So these are the aerobic things, the jumping jacks, jogging at home, dancing, exercise bikes, YouTube exercise videos. And then third is flexibility. So daily stretching exercises, or at least 2 to 3 times a week, maybe accompanied with your aerobic or strength exercise. And there are actually many resources that is available if you look for it. So look for those, like for example, this one, selected and easy flexibility exercises, something to start with and not something like this right from the beginning. Yeah. And then fourth, sport specific exercise. So don't forget that if you cannot go out and, for example, play a sport like soccer or basketball, you can still practice the acts or the steps and so forth in the exercise, even indoors, and that can help you to keep fit. And even the World Health Organization has come up with its own recommendations for home-based exercise. So there are many. Some of these are like, this is self-explanatory: knee to elbow, plank, back extension. So most of it done with just an exercise mat. Yeah, squats, side knee lifts. This is called Superman. So it's like alternate. Lift up your arm and your leg on alternate sides, yeah. And okay, a little bit more difficult with the bridge or chair dips. And there's also exercises that you can do to improve the depth of breathing, progressively deepen breathing for relaxation, de-stressing, and so forth. This is called a chest opener, seated meditation, or legs up the wall. Okay, so hopefully we will all be going in this direction, post-pandemic, easing back into exercise. So most of the time we have to advise our patients avoid rapid changes. So ensure that you have some background of doing certain level of activities first before you go jump back into your exercises outdoor or your old sport and so on. Essentially, ease in, probably it is the keyword, start slowly and work up to the pre-pandemic level. There is a 10% rule that they talk about, which means that, for example, if you are running 10 kilometers a week, the next week increase to 11 kilometers and until you are used to it, and then after that further increases. And all of this is with the purpose that, any type of, we do not want people to injure themselves by going back to exercise suddenly. And similarly, returning to the gym after the lockdown, less is more, so be prepared to take 1 or 2 day break in between. And in the beginning, always focus on quality over quantity. Look out for things like muscle imbalance, like problems with posture. So some of the things that they recommend is that, make sure, standing, if you're able to stand on one leg, the axis must be through the middle. And then if you're doing a plank, make sure that your muscle is well balanced. You are not getting too much strain on certain parts of the body. And always plan ahead and seek help from fitness professionals if required. And some general advice for patients about exercising outdoors: avoid crowded areas, keep 2-meter distancing, preferably solo exercise if you are just going out. In the beginning, even if you go out with one other person, try not to make conversation during your exercise. And generally, if you can exercise near your home, that will be best. You may want to start walking from your home and then walk back. Avoid taking public transport so that reduce the risk of infection. And similarly, limit the hand-to-face contact, because sometimes we want to wipe away the perspiration, adjust our glasses, all that. Avoid high-touch areas. Maybe you want to always use, for example, your left hand to press buttons and always only use your right hand to, say, touch your face or your eyes. Yeah. And also try not to do very risky sports activities during this period, because certainly we don't want to have serious injuries, go to hospital, and put more burden onto our healthcare system. Then I also get asked, because I do treadmill, so patients come to treadmill, they want to know whether wearing a face mask affect their exercise performance, or maybe they just want to find some excuse, something. So there is actually even a study done, randomized trial to study the effect of cloth mask versus surgical mask and no mask during bicycle exercise. But no doubt it's a very small study. But in this study, they find that really there is no difference, cloth mask, surgical mask, or no mask, in terms of time to exhaustion, peak power or peak workload, blood oxygen circulation, tissue oxygen circulation, perceived exertion activity, heart rate, and so forth during the exercise. So at least in well and fit people, really that wearing a mask doesn't affect them adversely during the exercise. Doesn't mean that they will do less or perform less well. So just a few take-home points. Continue to encourage your patients to exercise. Exercise benefits health, even without achieving a high fitness level. Moderate intensity physical exercise is associated with better immune function. Thank you very much.